Hey everybody, it's Eric and time for our video conversation. We did have some really good questions that came up this week, so we'll jump right into them. Actually, the first comes from Chris and Edina, who sent in an email. It says, Dear Congressman Paulson, nearly half of all people with Alzheimer's or other forms of dementia are in hospice care at the time of their death. Less than half of surveyed nursing homes have some sort of palliative care program. For people with advanced dementia, such care, which focuses on managing and easing symptoms, reducing pain and stress, and increasing comfort, improves the quality of life, controls costs, and enhances patient and family satisfaction. But as the demand for such care grows with the aging population, more must be done to ensure an adequately trained workforce. I urge and ask you to co-sponsor the Palliative Care and Hospice Education and Training Act. Sincerely and thank you, Chris. Chris, thanks for sharing your thoughts. For those of you that don't know, palliative care plays a very essential role in our healthcare system by treating patients that have other certain chronic care needs or a lot of pain. These are teams of doctors and nurses and social workers and physician assistants and others that draw more attention to that type of care and those who may need assistance. And we have a shortage right now of about 18,000 in the field of palliative care. I am co-sponsoring this legislation. We'll be just signing on, actually. I was a sponsor of it last Congress. I will be doing so once again. It's very important that we enhance the training and the education levels to bring more people into this field, as more people are susceptible to that type of pain. Next up is an email I got from Sean in Champlin, who emails in, Representative Paulson, I'm writing to ask that you please co-sponsor the Lymphedema Treatment Act. This bipartisan legislation also has broad stakeholder support. The American Medical Association, American Cancer Society, and numerous other organizations have endorsed the measure. It would help many people if you would co-sponsor this bill as well. Best, Sean. Sean, thanks for letting me know of your support. There are about 5 million people, Americans right now, that do suffer from lymphedema, which is an accumulation of lymph fluid. And this is something that is a chronic condition with no known cure. So it's increased swelling. And one of the only solutions that is out there is actually to ease the pain is compression clothing that compresses the joints or muscles to prevent the fluid from becoming a worse condition that leads to other hospitalization. So I am co-sponsoring this legislation, the Lymphedema Treatment Act, which would now require Medicare to cover this service for seniors, because we want to make sure seniors have a good, high quality of life, and right now they are not permitted to use Medicare services to cover lymphedema treatments through this type of clothing that prevents the anti-swelling. Thanks for sharing your thoughts, your ideas, and your concerns. Continue to reach out anytime on Facebook, Instagram, Twitter, of course, or on the website at paulson.house.gov.